these are the needle holders, and this is what is called the node pusher. First of all, we have to know the parts of the needle holder and how to grip it. This is the hand or the handle of the needle holder. This is the shaft, and this is the jaw. Another form of needle holders, this is the hand, the shaft, and the jaw, and this is the node pusher. This is the way how to grip the handle, and the thumb finger should be put here to unlock or open the instrument. This is how to lock the instrument, and this is how to dismantle this lock. When you close the handle, you will watch the jaw. Look, now I close the handle, I open the handle. When you see the jaws, you see only one part of the jaw is moving and the other part is fixed. Come to the second type of the needle holders. As you see, the handle is different from the previous one. The right way to hold this needle holder is that way. You put it here, your index finger is on this bottom, and you grip it with the hand. This is the way how to open it. The index finger is the finger which controls the opening and the closure of the instrument. As you see again, this is how to close the handle, and this is how to dismantle it. And when you look to the jaw, the same. Only one jaw is moving on the other one which is fixed. I will show you how to introduce the instruments, whatever the instrument, the needle holder, the graspers, the purlant, inside the abdomen through the trokers. First of all, you have to insert the instrument with the 45 degree between the instrument and the horizontal plane. Then you move the instrument outward with a 45 degree between the instrument and the vertical plane. When we do it on the other side, like this, 45 degree between the horizontal and the angle and the instrument, then we push it laterally like this. When you introduce both instruments in the same direction, it will meet at the bottom with a 90 degree, as you see. They will meet at the bottom of the picture at a 90 degree, like this. You see the angle between the tips of the instruments is about 90 degree. Classically, we cut the suture about 20 centimeters from the end of the needle. We measure nearly 20 centimeters from the base of the needle, like this, and I will cut it here. You hold the thread away from the base of the needle by about 1 to 2 centimeters, like this. This is how to hold the needle and the thread. If you have a 10 or 12 millimeter trocar, you can introduce the big needle like this through this trocar directly, like this. Another way to introduce the needle through the port side, the abdomen. When you have a 5 millimeter port like this one, and you have a large needle like this one, so you have to remove the port like this. Then you push the needle holder through the trocar. Then you hold the thread like this. You push it directly through the port side inside the abdomen. Then you push the trocar like this one. Classically, in the open technique, we hold the needle from its posterior third, like this, and the angle between the shaft of the needle holder and the needle is 90 degrees, like this one. But in the laparoscope, as your hand is not in the straight direction, it is slightly tilted with a 45 degree, so the angle between the shaft and the needle should be larger than 90 degrees. So we put the angle between the needle and the needle holder in about 120 degrees. Okay. As I told you before, if you hold the needle with the angle of 90 degrees between the shaft and the needle, look at the tip of the needle, it will be facing the instrument and not perpendicular to the tissues. So you have to open the angle between the shaft of the instrument and the needle base to about 120 degrees, like this, so that the tip is perpendicular to the tissues when you take the bite. Okay? This is how you take the bite. You push the needle, you hold the tissues with the other hand, you take the curve of the needle like this, you hold the needle, you free it from the other one, you dislodge the needle from the tissues, hold it again, the same angle, do the same like before, push the needle, hold the tissues, then hold the needle, gently. Okay. Then you pull the threads slowly, hand to hand, like this, hand to hand, but be careful to the short end, not to be escaped from the tissues. Okay, this is enough. This is the short end, as you see. This is the first bite, this is the second bite. Then we will take our note. We have to hold the needle like this. Okay. As you see, this is the classic, to hold the tip of the needle with the right needle holder. Okay. So the needle, the thread, the base and the short end is like the C shape, as you see. It is like the C shape. Needle, the thread, the tissues and the short end. Then this is called the smile suture. You can take it on the forward. This is the 1 round, the 2 round, and then you hold the short end like this. You can leave the needle, push the rounds, like this. Look, the short end is not moving at all. We just pull on the long thread, close. As you see, close, close, close. As you see, this is what we called a reef suture. We just tie it like this. Okay? When we take the other knot, we do the reverse. We hold the needle, which is coming from the right side, with the left hand. Sorry? We hold the needle with the left hand, like this. We should correct the position of the needle by holding the thread like this. So as the needle makes like a smile, Again, the C-shaped. This is the needle, the thread, the base, and the short end. It makes the C-shaped, but in the other direction. We do the same. This is the first round. This is the second round. And we hold the short end. You can leave the instrument, the needle now. Push the thread. We hold the long end, pull it. As you see, it is also a reef or square one. Okay. Looking needle, and this is the C shape as I said. This is the needle, this is the thread, this is the knot, and this is the short end. This is the C-shaped, Y-C shape. I fix my right hand, which is holding the needle, and I will move my left hand like this. This is the first round. This is the second round. Look how I am very close to the needle. Okay, then I will go to the short end, holding it. I will leave the needle, push the thread, hold the long end again, and then I will tighten the knot. Sometimes you can use the thread without holding the needle like this. Sometimes we do a small trick. The first round you take it like this. In the second one you open the jaw of the needle holder to prevent the first round to be dislodged from the instrument like this. I will show it again. This is the C shape. This is the first round. Look to my left hand, it's fixed, not moving. The right one is moving on the left one. Then I will open the jaw to take the second round, like this. You see? Then I will go to the short end, hold it, pull the left one or the long thread, like this. Like this. This is the first, or this is a bite, as I said. I hold the needle like this, take the needle out of the tissues, then I leave the needle and I will grip only there. You see, one thread is coming out and the other one is coming in. You will see the short end will be coming in a second. You see? And the long end is now outside the abdomen. Okay? Then I will make use of this long thread to make my knotting. Okay? This is the C shape, as I said, and this is the first round. This is the second round. I will open the jaw. Okay. Then I will go to the short end. Here is the short end. This is the long one. Look at the tie. It is a reef one. I will tie it so I still have a short end and the whole length of the thread is preserved. I will take another one. This is the C shape. This is the first round. I will open the jaw. This is the second round. Then I will go to the short end, like this. Hold it. Dismantling. I will leave the long end. Hold it again. And this is how to take the round. It is a normal round, like this one. Okay. I hold the two threads in my hand. Use the node pusher, like this. Pulling on the thread and pushing with the other hand towards the thread outside and pushing the needle holder. Look, make it close. You see, this is the node, and this is the node pusher is pushing the node towards the tissues like this. This is the 7. This is the 7. Then we take first round, open the jaw, second round, then we go to the short end, pull it again. This is the 7, you see. So the 7, take first round, open the jaw, take the second round, go to the short end, pull it tight. Okay. This is another form of suturing or taking note. I'll show it again. This is like the 7. You see, this is the horizontal limb, and this is the vertical limb. This is like the 7. Okay, take the first round, then open the jaw, take the second round, go to the short end, grasp it, pull it. It's okay. Again, this is the 7. Here is it. Then we introduce the scissor, like this, close. Then I choose to cut it like this one. It's the first thread, and this is close. You should not grasp the needle and pull it through it. You should grasp the thread and pull it like this, so that not to injure any structure during extraction of the needle from the abdominal. Another form of suturing, sometimes when you have a small thread or short thread, sometimes we do what's called the spaghetti technique in suturing. I will show it to you. You grasp the needle, you take your bite like this one, you come out the tissue, grasp the needle, take it out from the tissue again, then you hold the thread from here, then you start to do rounds like this. Look what I'm going to do. I'm going to do rounds, close, like this. This is one round, this is 2 rounds, this is 3 rounds. You see? I do many rounds around the needle holder, which is anchoring the long thread. Then come back. You see, this is more than 2 or 3 rounds around this needle holder. Then I bring the short end. I will make it a little short. No, I will take another round, close. This is another round. It's like you're eating the spaghetti, rounding the thread of the spaghetti around the fork. come back. Then you see this is the short end, and I will come back like this. Hold the needle, then open the other grasper, close, then go to the short end, grasping, and then pull it.